Facial tingling, causes, diagnosis. A sudden tingling sensation overtaking your hands, feet, or face is a fairly common complaint reported by people in the United States. It may be a result of either sleeping for prolonged hours on either of your limbs or sitting in the same position when reading or writing. Medically termed as paresthesia, a tingling sensation is usually an outcome of trauma or injury to the peripheral nervous system, PNS. The PNS is a component of the nervous system that connects the brain to the various organs of the body through a network of nerve fibers. It transmits information back and forth in the form of nerve impulses or signals. When a nerve is pinched or compressed, the transfer of signals may be delayed, slowed, or hampered, affecting the brain's capacity to interpret signals and send back responses. In order to cope with this phenomenon, the brain responds by associating the sensation to numbness and tingling. These are the first symptoms of a nerve injury. A mild or temporary tingling marked by a feeling of pins and needles can be relieved as soon as the pressure on the associated nerve is relieved. In cases of transient paresthesia, usually caused by a mild nerve compression, the symptoms resolve on their own. Tingling and sensory problems are common in patients suffering from neurological disorders, chronic painful conditions such as fibromyalgia, and other diseases, complicating the diagnosis at times. However, there is partial clarity in cases of facial tingling. In nearly all facial injuries, the trigeminal nerve is mechanically compressed, stretched, or inflamed. Facial tingling affects the facial skin region as a numb tingling or a skin crawling feeling, often coming without pain in the initial stages. If the predominant symptom is facial pain, then the disorder is called trigeminal neuralgia, a relatively well-characterized neurological disorder of the trigeminal nerve. What can cause facial tingling? Facial tingling is not a disease per se but a symptom of diseases inflicting the nerve or nerve function. It may be caused by a psychiatric disease, damage inflicted on the upper spinal cord or posterior part of the brainstem, dehydration around 5 to 6%, improper circulation of blood, vitamin B6 deficiency, individuals receiving chronic hemodialysis, malnutrition in chronic alcoholics, pregnancy or lactation, medications such as penicillamine, isoniazid, or phenelzine. Medical conditions related to the nervous system such as stroke, transverse myelitis, encephalitis, injury to the dental and facial region, compression of the trigeminal nerve, sarcoidosis, autoimmune disorder, a tumor or vascular lesion putting pressure on the brain or spinal cord. What are the signs and symptoms of facial tingling? Facial tingling is marked by a characteristic numbness and tingling sensation on the face. It may also be accompanied by skin sensitivity over the affected facial region, at times, pain. How is facial tingling diagnosed? Evaluating a patient's medical history is of utmost importance to ascertain the exact problem. Several patients may interpret the loss of sensitivity or any other neurological damage as a case of tingling. The objective here is to determine the areas with reduced or lost sensations and the perimeter surrounding the affected facial region suggesting nerve damage on a particular point. Your doctor may prescribe either of the following to ascertain the exact cause. 1. MRI or CT scan if the suspected cause is a stroke. 2. Blood tests if an underlying illness is the cause. 3. A referral to a psychiatrist if the cause is psychiatric in nature.